Matthew Holt. I'm in the Health 2.0 office. We have a guest today. This is Bruce Hellman. He's the CEO of UMotif, British company. Whoa, go the Brits. Bruce is going to show us what it does first, and then tell us a little about the company. So first off, what is the UMotif application? And it's all about, let's try and get this going, it's all about, that'll show relatively well, I think. It's all about patient self-tracking.
Yeah, fantastic. So the app works on iPhone and Android and the web, and this is all about people being able to track their health, self-manage better, and share the data with clinicians to improve shared decision-making. We're working in a variety of conditions, including Parkinson's, diabetes, heart failure, oncology, and other areas. One of our interfaces is the Motif with the... Can I just put it on the other mode? Take off the accessibility so you can see it better. The idea with the Motif is it allows people to track various aspects of daily life and score themselves on things that matter to them every day. So in Parkinson's, for example, we're tracking things like tremor, and you can see as I swipe my finger out, I'm just giving myself a simple score between 1 and 5 for different symptoms. So things like fluidity. There's also the ability to track your mood, and a timeline across the top, so you can actually track your mood multiple times per day. This is configured for different patient groups. So in diabetes, we track things relevant to diabetes. And then in the rest of the app, we've got things like cognitive and motor testing games. We've got daily diary, and we have a set of reminders for people's medications and their daily tasks. And all of the data comes back to form a really useful health report that people use to understand their health better and share that with their clinicians.
So you say that it sounds, from the way you talked about it, that actually this is sort of patient-driven, and it is, but for people recording the information across a wide range of diseases, starting with Parkinson's and going to others. But also, you've done a lot of work about getting this into the hands of clinicians so they can use this to sort of track their patients. So say a bit more about that.
Yeah. Well, in future, we think it's going to be completely normal and expected for every patient to have a digital health treatment journey with every healthcare interaction that needs to be centred around building the relationship between patients and clinicians, and indeed carers and family members. So the technology is built to help patients first and foremost, but then be able to share that data with their clinicians to help share decision making. So to make a better decision in that follow-up appointment, or indeed over Skype, or however the clinician and patient develop their relationship.
And so in terms of actually, progress and working on this starting in the UK and also going into other countries, where are you so far? Because you guys have come quite a long way in the last year or so.
Yeah, so we've been going for a couple of years now. We're deploying in a number of patient groups, the first 16 deployments, including up in Liverpool in heart failure, Preston up in the northwest in oncology, and our largest work is in Parkinson's disease. We're doing a randomised controlled trial in 7 UK centres. It's been ethically approved, adopted by the Clinical Research Network, and the protocol has just been published in a peer-reviewed journal.
And then tell me a little bit about your international plans, because those are all UK-based sites, and you're obviously a Brit like me, probably from the UK. Where next?
Yeah, so hopefully Australia should be our first international deployment, and then we're here in the US because we were doing a demo last week at the Body Computing Conference.
Don't know, rival conferences? I'll just have to have words with you. See about that, yes. But you were on a Health 2.0 last year, and you will be on a Health 2.0 Europe in a little bit.
Absolutely. And then developing the network of people in the US. And then also shaping plans for a big citizen science project to kick off next year, aiming for 100...
So say a bit about that, and what's the idea behind that?
So the idea is to run a project with 100,000 people with Parkinson's and healthy controls, or non-Parkinson's controls, each tracking using our app, plus a load of sensors and wearable devices like MIFS, Fit, Jawbone, Withings, and pooling all of that data and making it useful for and freely available for academic research. So it's a big doing project that leads to big data from which will become big discoveries.
Great. We love data discoveries. That's our last block of the 4 stages of Health 2.0. So sounds great. Talking with Bruce Hellman, who's the CEO of UMotif from the UK. Thanks for dropping by.
Thanks.